So we'll start now. It looks like I'm not sure if the other presenters, we're supposed to have Omunota Opodu, then Amina Abdallah, and then Annabella Saikom Danzi. But I don't see them either in person or online. So Amina, since you are here, we'll give you the honor of presenting first. So thank you. You can go ahead.
Okay. All right. Good morning, everyone.
Oh, sorry, you sent your presentation, right? Did you send your PowerPoint?
I sent you, but I can share it here as well.
Okay, yeah. You can screen. That's good.
Yeah. Thank you so much. Good morning, everyone. My name is Amina Abdallah, and I am a graduate student here at Kansas State University. Before I move on to the weeds of this presentation, I would like to say a big thank you to the organizers of this conference for giving us this opportunity and platform to share our work, our research work, which is so important to us because this is about immigrants, communities here in the US, and as an immigrant and as an international student, this research work was so important to us. So now I'll just go ahead and then share my screen, and then I'll go on to present the work. Says that sharing is not allowed, so I would have to send a request. Okay, thank you. I hope you can all see my screen.
Yeah, we can see it.
Okay, thank you. So as I said earlier on, this particular research is about immigrant communities, the kind of challenges we normally face when we visit the hospital. And so as communication students, we thought it wise to kind of go in and talk with other immigrants and then listen to their issues, the kind of experiences they have whenever they visit the hospital, in order to develop certain strategies for effective healthcare delivery through cross-cultural communication in immigrant communities. So this particular research is to develop some effective communication strategies for the healthcare providers here in the US, be it a doctor, nurse, any physician, and how best they can serve the immigrant communities here in the US. So the issue of migration has always been a big social issue, not just here in the US, but it is a global issue that the global communities are working on because it's always on the rise. And there are around 244 million migrants living outside their home country, their country of birth. And 41 million of them live here in the US. So just imagine the kind of system that the US government would have to put in place to kind of serve the number of migrants that come in, day out. And one of the challenges that the government here face has to do with healthcare, because the government is expected to give some basic needs like providing healthcare, education, and also accommodation. And one of the barriers that often come across whenever healthcare is concerned when immigrants go to the hospital, it has to be with language barriers and cultural issues, because if a nurse is not able to understand the background of an immigrant who is there receiving medical attention, sometimes the issue of language barrier could lead to maybe her not being able to understand properly what the issue is, what the patient's issue is, and that could lead to poorer health outcomes. And that is a big issue. Even here in the US, some healthcare providers do understand that there is a challenge for providing culturally competent care to other immigrant communities. And that's why this research is so important, because our aim is to explore immigrant patients' experiences to develop effective communication strategies for healthcare providers. As well, our main focus is to help in the improvement of healthcare outcomes. So yes, we want to develop some strategies for effective healthcare delivery, but one thing that we are looking at the end of the day is for this to help in the improving of healthcare outcomes. Because if our healthcare providers here are culturally competent when it comes to communication, when it comes to understanding the different backgrounds of people that they are dealing with, definitely it will transcend into the healthcare outcomes. And that is the main important thing that we are looking at. And so it weighs this particular research in a theory, in a theoretical perspective. We looked at the communication accommodation theory. So this theory was developed by Howard Gills, and this particular theory focuses on how individuals can adapt their speech, vocal pattern, gestures, and other communication behaviors to either converge or diverge from their conversation partners. So in this particular situation, when we are looking at how healthcare providers can change or adapt their speeches in order to cater for the diverse background that they are catering for, this particular theory is quite important, and that's why we are using it. So the key concepts of this theory looked at convergence, whereby in this particular we situated in our research, whereby the healthcare provider will adjust his or her speech and behavior in order to cater for the needs of the immigrants. Emphasize also the difference in communication. Yes, this person is a healthcare provider. His kind of communication would not be the same as someone who is just a patient. So this particular theory is saying that let's emphasize the difference. Yes, we know that there are differences, but we differ to agree in certain terms as well. So the differences can transcend into an agreement. So knowing that I'm different, knowing that this person is different, can help me deliver the kind of messaging that is relevant to the other person. Excessive adaptation. So the fact that there are differences, if you don't take care, if you want to adjust your speech so much, you could do it to the extent that the other person would feel extra comfortable. Yes, we want the comfortability, but the person is a healthcare provider, and that's something that should be understood. That professionalism should be there. Under accommodation, insufficient adjustment, if the healthcare provider doesn't really go into understanding the importance of adjusting their speeches, then there could be a problem. So this particular theory situates very well with the kind of with our research, and it's so important. So these are some of the researches that have been done using the communication accommodation theory in improving health outcomes. So a couple of researches have been done by Nicolai and colleagues, Chevalier and other colleagues as well. So these are researches that kind of marry with the kind of research that we are doing as well. Based on our literature review, we came up with 2 research questions. One is, in what ways can healthcare models be adapted to be more culturally and linguistically appropriate for immigrant patients? And the other is, what are the key language and cultural barriers in communication? So we looked at some literature reviews, and these are the questions that came up. So for our methodology, one thing that was so important was to get approval from the Institutional Review Board, IRB, because obviously we are dealing with human subjects. Because we are going to we did a semi-structured interview with our participants. So definitely we needed to get the approval from IRB before we could go ahead and start with our research, start collecting our data. So researchers have emphasized the effectiveness of directly asking individuals for their opinions on a particular topic, which aligns with the semi-structured interview approach that we undertook in this particular research whilst gathering our data. So doing this sampling, what we did was we just did a snowball sampling, because we are international students and we have friends who are also international students. And so instead of maybe going outside our comfort zone, we decided that why not talk to the international students here and listen to their experiences, what they have faced whenever they go to the hospital. So yes, we did a snowball sampling, and then we got our participants from there. So we made sure to recruit immigrant patients within Kansas State University. As I mentioned, our colleagues who are international students as well. And we partnered with the student organization here to do the snowball sampling to get our participants. The ethical consideration that we made sure to do here, yes, one, obviously we had to get the IRB approval first before we could start our research. And one thing we also made sure to take note of is the participants' anonymity, which is very ethical in the sense of dealing with human subjects. And potential volunteers were given details of the information about the objectives, method, their rights as participants, and even telling them that they can withdraw whenever they feel that they are not ready for the interview. They can withdraw anytime. So no one was forced when it comes to this particular research. And informed consent was obtained from all participants. We are dealing with humans. We have to take their informed consent before we could start. Data analysis, we interviewed 10 international students, and then we identified certain key themes from the issues that they mentioned. We read transcripts repeatedly to gain an overall perspective, and then selected the relevant sentences or phrases pertaining to research questions. And that's the justification for using 10 participants. Someone would say 10 participants are too small for this particular research. Yes, it may look small, but this is a qualitative research, and other studies have looked at how it's not so important, the number of people, when it comes to qualitative research. It's about the insights, the kind of message or the kind of data that you are getting that is so important. And these are the researchers that have looked at even smaller, some 19 participants, 12 participants, and they brought out really good data. So for us, using 10 participants, we are justifying this because, yes, it may look small, but then again, other researchers have justified using smaller number of participants because qualitative research does not impose strict number of participants. It's all about gaining up meaningful data that reflects the participants' experiences. So based on the data that we gathered, these were the major themes that we looked at. Yes, some people mentioned language barriers, cultural sensitivity, and systematic challenges. So these were the main themes that people talked about. So some of them said that they had difficult with vaccination records due to language barriers. So some of them said high cost and transportation was also a barrier. So this also is how we looked at the systematic challenges as well. So this is after looking at our data, after the results, we decided to discuss and then give our recommendations on how best healthcare providers here can have an effective communication between themselves and immigrant communities. So these are the results, as I mentioned: cultural sensitive competence, systematic structural challenges, language barriers, and communication challenges. So these were the challenges that we outlined. So what we are discussing is we have to integrate findings with literature on healthcare policies. So we did that as well. So the findings are cultural competence training. It's so important that there should be some kind of system where the healthcare providers here would be given the cultural competence training so that they can adapt to any kind of situation. Looking at the 41 million people who are immigrants, who are living here in the US, it's only natural, it's only fair that there should be some system where these needs are met. So cultural competence training is very important. Development of language service in healthcare setting is as well important, and also advocating for policies that reduce healthcare costs and improve transportation accessibility. Those are systematic reforms. So one major challenge, as I mentioned earlier, was the number of participants, but these are some of the challenges as well: subjective and qualitative analysis. So we are international students, we are immigrants, so we could be subjective in our in interpreting the data. It's only natural because we are having an inductive content analysis. So there could be a bias, we admit that. Geographic and institutional limitation, the fact that we only took participants from Kansas State University is a big limitation, and that's something we also acknowledge as well. So in addressing these limitations, we argue that to mitigate these limitations, future research should incorporate mixed method approach by combining quantitative measures and qualitative reviews to give reliable and generalizability of the findings, as well expanding the sample size. So as I mentioned, we only did 10 people, but expanding and having more than 10, probably 20, even though we justified it, but having 20 could have diverse issues that could pop up. Engaging independent reviewers in the analysis could be a way of addressing all those limitations of research. In conclusion, these are some of the recommendations that we believe would be important in addressing the issues of barriers and also cultural issues when people visit the hospital, when immigrant population visits the hospital. One is enhanced language support, development of language service in healthcare setting. Two is cultural competence training, as I mentioned earlier, implementing regular cultural competence training for healthcare workers to improve patient-provider interactions and understanding. Three is as well systematic reforms, addressing systematic issues by advocating for policies that reduce healthcare costs, for vulnerable population and improving transportation accessibility for all. So that's all for our presentation. Thank you for listening, and I'm opening the floor for any questions, any thoughts, concerns, and discussion. Thank you.
Thank you so much, Amina. Your research is interesting. I mean, my focus is also migration studies. So, and since you're the only presenter available, who else came in? Oh, she's going to join. Who? Which one?
Yesterday we had some
Okay. All right. So yeah. I was going to say, because you're the only one who signed in and I'm in migration, this is my field, we're going to have the whole 1 hour to you for discussion. But anyway, so yeah, this is interesting stuff for me. So I will ask before I give my comments, and because I will probably go on and on and on. So I'll give the floor to other people.
Yeah.
Ask where you're located at and where you do your outreach from. I think I missed that part, or I'm not quite sure physically where you work.
Oh, sorry, I forgot we have a mic.
Yes. Well, so you have to.
What happened?
Oh.
Something.
Oh, goodness.
Actually, this should be. Funny thing. Okay, well, you know what she was on.
I think you can hear.
Can you hear?
Okay.
Yeah, can you hear us okay, Amina?
Yes, but I hear you from afar.
You are muted.
No, she's not muted, we can't hear it.
So this was this should have everybody on it.
Yeah.
Yeah. Can you hear me? Can you hear us now, Amina?
Yeah, I can hear you, but though, yeah, I can hear you.
Oh, so I was just asking where you're located at, where you actually do outreach at? Because I think I missed that at the beginning if you said that.
My location, as in terms of my school, or
As in where you use these outreach programs? You said some hospital, but I think I missed it.
oh, we haven't really reached out to hospitals. We looked at the experiences of immigrant communities. So maybe at the beginning, I was talking about the fact that people do go to hospitals and have encountered some issues when it comes to effective communication. So maybe that's the part that you had, but we did not reach out to hospitals. We were just looking at the experiences of immigrant communities here.
Okay. So you're not located in the Kansas City area, right?
No, I am in Kansas State, but not in Kansas City area. We are in Manhattan, Kansas State.
Because there is actually an outreach program that they presented last year, and they have some facilities here in Kansas City. So I thought you were associated with them. You
No,
might.
no.
Okay, well, they might be useful to you because they had some studies too as well.
Okay.
Yeah, so, okay, I'm gonna move away from here and give it back to Crystal Bell.
Okay. Okay, so yeah, sorry for all the up and down. We're trying to get some people, the other presenter onto the room. Something is happening with the connection.
Okay.
And yeah,
I think Ryan did put something in the chat towards to me.
all right. There's a question for you in the chat from Ryan Gibb, and he says, "Thank you for this important work. I teach in the health humanities at a small undergraduate institution. Does your institution, KSTED, have any outreach in their clinic? What does this look like for graduate students and undergrads?
Can you please repeat the question again?
You can, it should be in the chat. If you didn't hear it clearly, you can read it in the chat.
Okay, let me see the okay. So we have a clinic here, which is the Lafine Health Center. It's not that much of a big clinic where like we kind of have an outreach there. No, it's just a normal clinic where we just go and have checkups and all that. So we don't have a system or an outreach to the clinic. No, we don't have that. It's just us going there and having ourselves get checked up. So yeah, I don't know if my answer answers your question, but that's about it.
Yes, thank you.
Thank you.
Okay, so my question or comment or whatever it comes out as is you said your sample is just made up of graduate students, right?
Pardon?
Or just your sample is made up of international students, right?
Yeah, international students, yeah.
Okay, so my question is, and my comment is, how representative is it of the immigrant population language difficulties? Because for international students, enrollment into US universities, we have a basic English requirement, right? So it means at some point we are able, as international students, to some point, we are able to communicate using English. It might not be the best, but we have a basic understanding of English. And then of the 41 million migrants that you mentioned, these are obviously not just international students. These are people who are coming from different and diverse backgrounds, and they might not necessarily need to meet an English language proficiency. Right. So how representative is your sample? Because I think that's kind of like my challenge with your sample. You've taken international students who are required to have a minimum level of English proficiency before they can be enrolled into into US universities, which is different for just non-student immigrants. They don't have to have any English proficiency of any sort. So how much then is your sample representative of the immigrant community as a whole? Because I think because of that basic requirement that universities require, that might make, for me at least, that might make your population not very representative of immigrant communities, but rather representative of international students and not necessarily immigrant communities at large.
Right. Thank you so much for this question. So we do acknowledge the fact that our sample or our participants do not necessarily give that generalizability effect because we only looked at international students. And as you rightly said, one of the requirements is English language. So this we did look at international students hoping to find that, because we did assume that yes, there are some issues that people face. It's not just assumption, because we have also gone to hospitals and we face one or two issues when it comes to language as well, when it comes to the cultural sensitivity and other issues. And so we looked at all those aspects. We just didn't look at language. If our research was just about language, then yes, what you said would be a perfect name. But yes, what you said has a part, because international students do are required to have English before coming here in the US. But then again, language is not the only issue that we looked at here. We looked at other key themes like the cultural sensitivity, how the different backgrounds can sometimes affect the kind of communication that would happen between a healthcare provider here and an immigrant. So rightly so, we do acknowledge the fact that this number, this sample does not reflect the general population that we are looking at, and that is a limitation we do acknowledge, but we intend to also work on that. I believe this is not where our research will stand, so we will take into consideration what you are saying and we will develop our research. Thank you for that.
Okay. Well, thank you for your response. Any other questions or comments or observations? Okay, another question from me. I'm just trying to also, maybe I didn't get this from your presentation, but who has the burden of how can I put it? I mean, like you said, as you said, there are 41 million migrants in the US, right?
Yes.
And these are coming from different cultural backgrounds and languages and stuff like that, right?
Yeah.
And it's honestly not feasible to expect a health worker to learn like 200 languages or to understand the difference. So who has the burden of ensuring that there is understanding between the health worker and the patient?
So one thing that we mentioned in the recommendation is the fact that, yeah, it's not so necessary that the health worker will learn 200 languages, as you mentioned. But one important thing is, as for example, why we included the communication accommodation theory, is that a health worker can adapt sometimes their behavior, sometimes their mannerism, sometimes the way they speak could be a way of welcoming the immigrant. So it's not just about the language barrier, not just about the language difference, but sometimes our actions, our mannerism could be adapted in a way that the immigrant would feel comfortable to share. And one of the things that we looked at in the recommendation is the fact that, like, there could be a language service. So not the health worker particularly being able to speak all those different language, but having an established language service in healthcare setting is a way to solve these problems. So if there is a health care service or language service in a hospital, so when issues like these arrive, it's them that burden will fall onto. They would be the one to cater for such issues. So we are recommending that the government would have such systems in place in hospitals so that these issues can be solved. And again, cultural competence theory and this training, understanding people's belief systems could be a way. It's not just enforcing it on the healthcare provider, but this is a way that to let them know that they have to adapt the way the way they serve other communities. So those are the two things that I think could answer your question, because we are not saying yes, every health worker should learn 200 language. We are saying that there could be a system in helping these immigrants when they come in, because if there is a language service, that could cater for that problem.
Thank you so much for your responses. Anybody else with anything to add? All right, so thank you. we are trying to get the other participants. They are having challenges accessing Zoom, so we are working on getting them. So may you please give us maybe 5 minutes to see if we can get them connected, and then they can go ahead with their presentation. So thank you so much.
Yeah. I stop sharing my screen.
Yeah, you can stop sharing. Thank you.
Okay.
Angela, I saw you. I think I saw a message that you were on the phone with. Can you send her the link that you used, because she's saying she's trying to get in.
Yes, I sent her the link, but it won't let her in because it's associated with my name. And she tried registering. I've also used the link given to me by Doreen. I tried sending just the code with the passcode. That has not worked either. Registration page says the meeting is closed. Every avenue says the meeting is closed.
Can she try like to join the meeting and then enter the without not using the link, but to join the meeting?
Yes, she tried that too.
Okay.
I gave her the meeting code.
That's weird considering you guys are on. Oh, can she try again now? Can you ask her to try again?
Okay, with just the code?
With just the code, or link or the code? The link. Can she try the link?
Okay. She's trying it now. It's allowing her to register, so she should be able to join soon. I will also send what you just sent me.
Okay, Annabella, welcome, finally.
Hello.
Yeah. All right. So
Can you all hear me?
yes. Okay. So welcome, Annabella. Am I? Oh, yeah. Good. Welcome, Annabella. So you can go ahead and I'll leave the floor to you, and you can go on with your presentation. Do you have a PowerPoint presentation? I think you can.
What was the question? Sorry.
I'm saying, do you have a PowerPoint presentation?
Yes.
Yeah. So
Yeah. So I can just going to share my screen.
yeah, you can go ahead.
Um, Are you able to see my screen? Okay, thank you. So my name is Annabella from University of Missouri, Columbia. I'm just presenting on, I like remittances, so I'm looking at migration and development and just looking at how remittances contribute to socioeconomic development in the global South, specifically sub-Saharan Africa. So I'm looking at the extent to which education, in this case, I'm looking at primary, secondary, and tertiary education, the extent to which households that have these levels of education have different consumption patterns, and then how does that inform GDP growth and poverty alleviation. And so I just want to chip in that this is just it's just the beginning of the project. I've not really been able to analyze data and all of those things yet. I'm still working on it, and I just want to share these to get some feedback that would help me in building my theory and method. So for background, there's been definitely a lot of studies that are trying to explain development and poverty alleviation in sub-Saharan Africa. And then some of these variables that have been explained are Human Development Index, in this case, how human capital contributes to it, how institutions and foreign income like FDI or foreign direct investment contribute to all of these. And the other thing that has been explored in the literature, the bigger thing is that most people tend to see remittance to have no productive economic investment. And so that is what I'm trying to chip in and go like, that is not really what it is. And so I have two major gaps that I'm trying to address. The first one is that existing literature seem to emphasize very much on strong government institutions to be the principal investor in education. And then I'm trying to say that, well, in the absence of these strong government institutions, what happens to the people in there? And my argument is that I want to investigate the extent to which remittance has that substitution power to contribute to education. And then the end effect is that it contributes to boosting economic development. So remittance investment in higher education, and I'm trying to say that tertiary education, to be specific, yield better economic outcomes in the long run. Remittance substitute for weak institutions, and then the causal mechanism is that it increases purchasing power and consumption power, and by so doing, contributes to economic and poverty alleviation. So I have three main hypotheses that I'm trying to look at. The first one is that remittance in tertiary education yields a relatively better economic growth and poverty alleviation than primary and secondary education. The second is that investment in secondary education also yields a relatively better outcomes than I would expect in primary, but not in tertiary. So the first two hypotheses is just putting primary, secondary, and tertiary education in a continuum, and then just arguing that the more remittances invested in higher education, in this case, tertiary education comes first, there's going to be more positive outcome. That is the hypothesis I'm trying to make. And that just leads me to the third hypothesis, that tertiary education should have the highest economic returns and poverty alleviation. So for main variables, I have for my main independent variable, I'm trying to use an interaction model. So I have personal remittance received mediating with education. And so I'm going to mediate primary, secondary, and tertiary education. And then the first dependent variable is GDP growth, and then the second is poverty alleviation. So the first model would look at how primary education mediated with remittances impact GDP and poverty alleviation. The second would be secondary education mediating with remittances, and then the effect of that on GDP growth and poverty alleviation. And then the third one will be remittances mediating with tertiary education, and then the effect of that on GDP growth and poverty alleviation. And then I'll just try to see the variation in outcomes. So for these are the control variables that I'm looking at currently. And if there are any that you all see to be significant but being missed out here, I'll be happy to look at those. So for my design, I have two phases, where the first phase is just a pooled OLS, where I'm using this interaction model for all those levels of education, and then trying to see how these impact GDP and poverty alleviation on each education level. The second phase, I'm trying to see the remittance consumption pattern using household survey data, specifically socioeconomic survey data from the National Bureaus of Statistics for Ghana, Kenya, and Nigeria, and just trying to see how households' demography, specifically the education attainment, informs their consumption pattern with the remittances they receive. Yes, so that is all I have for now, and I'm happy to receive your questions and comments. Thank you.
Thank you, Annabella, for your presentation. Okay.
I was curious, how did you decide that? Can you hear me?
Yeah, just a little echo, but I can.
Oh, is this better?
Yeah.
Okay. So how did you decide on Ghana, Kenya, and Nigeria? What variables made you think that they're comparable or compatible?
Yeah, so I chose these three countries because looking at when I try to look into the top remittance receiving countries, they're part of like the 4 most remittance receiving countries. And then comparing their levels of development, I saw them to be on the same, I would say almost the same level, which is why I felt, okay, I feel like I have that, homogeneous baseline characteristics to make a comparison.
Sorry. Okay, I'm gonna just have a follow-up to that. So did you look at the education attainment levels based on like World Bank reporting or the FBI studies that come out of DC?
You said, did I look at what? Sorry.
At the comparable education levels, like how many, like the percentage of population that has tertiary education or secondary education? Comparatively speaking.
Do you mean if they have a variation in that?
Yeah, how do they compare across? Like, is that part of what you, for your baseline? Like, do they have comparable numbers in terms of percentages of tertiary, secondary, and primary education attainment?
Yeah, so what I basically did was to compare the levels, the predominance of these education levels there. And then I saw that yes, these countries seem to have almost similar I wish I had the statistics, but they have like a similar levels of these kinds of education. It's not as if one has more primary education predominating than tertiary or secondary education.
Okay, thank you.
Mm-hmm.
I have a question. I think I probably might have missed data along the way. I don't know, but how did you measure your main variable of the study, the remittances? Like, how did you measure it?
How did I measure the main variables?
Correct. The remittances, like what is your measure?
So for the the main variable here is personal remittance received, and I'm getting all these data set from the World Bank, and mediating that with the individual education level. So like I said, this is an interaction model. So I'm interacting personal remittance with primary education with primary education, that is 1, with secondary education 2, and then with tertiary 3 for each country. And then I'm trying to see how these affect GDP growth and poverty alleviation in each of these countries.
All
And
right.
I would try to see the variation if if primary education, like what is the effect or the impact, what is the weight of primary education interacting remittance to GDP growth and poverty alleviation? What is the weight of secondary education and remittances on GDP and poverty? And the same thing for tertiary. My hypothesis is that tertiary education should have more weight. That's what I'm saying for hypothesis. But then generally, I'm trying to see the variation in that, and then to see if indeed tertiary education out of primary and secondary education has more weight on GDP and poverty alleviation.
All right. So so all the data comes from World Bank.
Yes.
So how do you, maybe is part of the limitations, because the World Bank indeed captures these remittances, but there are so many informal kind of like, that happens. Like, how do you account for that? Do you just account it as a limitation, or do you have a way to kind of control for what should potentially not be captured by the World Bank data?
I'm trying to understand is it like the different forms of remittance captured by the World Bank?
Yes, I'm saying like the World Bank captures the data, but there is like so much information that is not captured, that is kind of like all informal, like, or other ways that probably are not captured by the World Bank. So I'm saying, like, do you have any way to control for those kind of unaccounted for, like, I mean, those like transactions that could have happened outside of, like, the formal sector that are not capturable by the World Bank? Or do you just like discuss that as a limitation to your study?
Okay, I think I get it. Is it like, so there are some informal remittances that are not captured, and so how do I control for those?
Correct, yes.
Okay, yeah, so well, I believe that would be a limitation to it because I wouldn't have, those data set are not made available because unless there is a source you could suggest to me, but the World Bank just captures these formal remittance transfers. And then those informal ones like monies that are given directly to family members through someone else traveling back home cannot be captured, if that answers the question.
Yes. So I don't know if you if you've been able to tally what the World Bank reports and also the reports from the financial institutions from countries, like for example my home country Zimbabwe, the the annual, I think it's done every November, the annual budget, when the Minister of Finance presents the annual budget, they talk about what has been received as remittances in that annual budget. So if you compared what, I don't know with other countries, I'm speaking of only what I've known. If you compare those numbers that probably get published by the financial institutions for those countries against the numbers that is presented by the World Bank. And then of course, those the financial reports I'm talking about that come from the Minister of Finance or whatever the institution in the respective countries, it doesn't cater for informal. I've done a lot of transactions informally myself, like more
3/4 of mine are informal.
It's just like looking for somebody who's there, who's doing a project there, or somebody oh, do you know someone who's doing this? I want money here. Yes, I have money here. Let's swap. I have a project here. It's like almost like 80% of my transactions are informal, and are not captured either in the financial reports as well for my own country. So so my question is do they tally what we have, the information we have from the World Bank, does it tally with the reports that are presented by the financial institutions of the respective countries that are in your sample?
Okay, so as currently the main thing I was looking at was the personal remittance. From the World Bank, I didn't really get into what financial institutions were providing, and I'm going to look into that. In my mind, I'm not sure if they would specifically split out and make it very outright that, okay, this is the contribution of remittances to what we have. I don't know if that makes sense, but being able to sift out the remittance component in those money these financial institutions have is what I'm trying to drive at. So I don't know. I would have to look into that.
Thank you.
Okay, can I just kind of like a follow-up on what she's saying? I didn't, maybe I missed it as well. I think also her question was how do you account for those informal remittances in your work? Because like she said, I also deal with migration, and I know the largest portion of remittances in Zimbabwe is informal, especially from the region, because somebody just goes to the bus coming from South Africa to Zimbabwe and they give them an envelope of money, and that's not captured anyway. And a lot of people, and that's a very big portion of that. So I think her question, and I didn't really get how you answered that, is how do you account for those remittances? I had the numbers somewhere, what percentage of remittances are done informally, an estimate of the informal, and it's quite a significant number. So how do you account for that in your regressions and in your stats? I think that was what she was asking, right? Yeah. How do you account for that? Do you have a dummy variable that you create for those, or what? How do you account for that so that your results are not biased or are not missing something?
Yeah. So yes, that is what I was saying, that this project is still in the very primary stages. And so as of now, I didn't have any factor for these informal forms of transaction. And I just started off from what the World Bank has to provide. And so then she mentions financial institutions of these countries. And so that's what I said, that I would have to look into it to be able to make up for those informal transactions. And if I have to create a dummy variable for receiving or not having these kinds of informal transactions, then yes, I'm gonna have that included in the model.
Thank you.
Mhm.
Since you are just starting out, I can give you a couple.
Thank you.
Can give you a couple of advice on where to turn your attention. Number one, surveys and interviews. You need to conduct surveys with migrants and their families to know or gain insight into remittance flow, amount, and frequency.
Okay.
To a certain extent, we track those envelopes being dropped by drivers and stuff like that. It's commonplace. And I remember that Oxford University has a program that deals with that covers quite a lot of. I remember 2017, I presented it back there, where we discussed something like that. And also, my former university, Leiden University, also has something very strong that track that. Then we have a number of NGOs that work on this, and they report a number of stops relating to how much was being sent by who, through which informal network and stuff like that. So financial institutions have been mentioned, so we don't need to go into that. Then we have a number of mobile money services in different countries. Some are local, some regional. For instance, I've sent a couple of money home to Nigeria through Guarantee Trust Fund.
Mhm.
Were those captured by World Bank data that had you can also look at census data. Census data, you can look at diaspora organizations. Diaspora organizations, speaking with them will tell you quite a lot about what informal networks are being. In Springfield, some years back, we had this woman who would collect $1 and had accounts in Nigeria through which and she was doing that, she was undocumented, and she was doing that for years. She was doing that for years. She has moved to Dallas now, so, and I'm very sure that she's still doing that. All you need to do is place a call. Hey, madam, I need so amount deposited into so account. Once she receives your $1, she was very honest. So she was able to build a huge clientele in Springfield, Missouri. So looking at that will help you a lot. Then some government report, I know somebody has mentioned that local informal money transfer agents. Because I work on terrorism, we also do all this. That's why I have some kind of insight into all of this. And it's one thing in terrorism studies, follow the money.
Right, just to complement on what he's saying, I think basically what we're all saying is like your measure is a very important measure. I'm not downplaying the World Bank, but I think I wouldn't be surprised if it's only a tiny fraction, actually. So the conclusions that you probably might make based on just that one measure, which happens to only contribute a fraction, if not even less than 50% of the actual remittances. The conclusions can actually be a little bit misleading because the measure itself is inadequate. It tells you just a fraction of the story. The story is actually out there with measures. Unfortunately, those measures are not very quantifiable. That a lot of them, but it's like hard to follow up. But unfortunately, that's where actually the information is, the bulky part of it. I don't know whether, like earlier on, I think we said we're going to mention it as a limitation. I think probably you might want to go beyond just mentioning it as a limitation, because the limitation it's kind of like a limitation that is big. So probably I would definitely consider some of the channels that the previous speaker already said, in terms of like trying to incorporate those aspects And
Mhm.
a dynamic variable where you would account for, I don't know whether you want even to create a dynamic variable. It will be up to, like, since this is just the beginning, I'm glad that you actually came because we're getting all these. I mean, you're just beginning and you're getting all these, whether you're going to create a dynamic variables or you're going to incorporate this as part of your measures.
Mhm.
But I think I would just basically say, just mentioning it as a limitation to say, oh yeah, but then, no, this is not a very accurate measure. It's not like, no, that's not the whole story. I think that would be like limiting the scope of the study.
Actually, yeah.
Okay, so there is one place that may have some of those informal variables. I've used it before, the Global Data Barometer report.
Mhm.
I just Googled it to make sure
It
I
does
was
have-
finding the right thing.
yeah.
The Global Data Barometer report. For instance, this isn't Africa specific, but India sometimes has been accounted for as 80% of its GDP is actually informal. So that's just to give you like a glaring example of how off some official reports can be.
Mhm.
And of course, we know in Africa, informal work is probably higher than formal work because most formal work is only government work or the larger corporations. But all the mom and pop shops and all the smaller chains tend to not be as reported as equitably or as consistently. So yeah, so this Global Data Barometer report, it tries to factor in some of those things.
Okay.
All right, so as we round up, I'll also give you another site that you can use, United Nations Department of Economics and Social something. It's UNDESA. It also has some data. You can also use. I also use CIA files. It also has like that. And I also wanted to add something that you might also take into account, the non-pecuniary remittances. The non-pecuniary, and these also make up a bulk, like people send computers home, right? And a computer, right? A laptop will cost a lot of money. If somebody sends a MacBook is like at least $1,000. So that's quite a significant amount of money. So you also have to look at how you can capture non-pecuniary remittances as well and include them in your measures, just to see how, because they play a very big part. Sometimes people are not sending money, but they're sending goods back home. And that also, you might just need to figure out a way how to capture that in your data as well. So yeah, thank you very much. I think this has been helpful, and I like that it's at the beginning of your research. So you get a lot of input and you get a lot of insight into how to make your research better.
Yeah, thank you.
Yeah, we have come to the end of the session, right on the dot, on time. So thank you, people, for being here. Thank you for attention, and thank you for your presentations. And we'll meet in the next session. So now it's time for a break. But I think in the next session, there is no, we are all, if you want to join us, then you use link A, because for the next session, we are all in one room. Thank you so much.